Welcome, graduating residents, fellows. Welcome to program directors, department chairs, and to all of those who are joining virtually, family, friends, and others. Although you can't be here physically, we know you are here in spirit. For those who don't know me, my name is Dr. Ken Sable. I am the regional president for the southern market of Hackensack Meridian Health, and it is my privilege and honor to welcome you to Jersey Shore University Medical Center's 2021 Resident and Fellow Graduation Ceremony. The ceremony today represents the culmination of all of your hard work, long hours, and commitment to learning and honing your craft. As you begin your personal journey in your chosen and noble profession of service to others, I am grateful for your time at Jersey Shore. You have made significant contributions to our successes, conducting leading-edge national medical research, providing essential care for some of our most vulnerable patients, and working collaboratively with our faculty, nurses, and all of our academic medical centers teams to achieve excellence in clinical care. During this once-in-a-lifetime, hopefully once-in-a-lifetime pandemic, you continue to shine with your dedication to Jersey Shore and to our community, regardless of the challenges that all of you faced day in and day out. I am thankful for the resiliency and compassion you have shown throughout this crisis. It's amazing that 19 years ago today, I was in your shoes at Cooper University Hospital, graduating from the Department of Emergency Medicine residency program. And I distinctly remember my chairman at the time, Dr. Michael Chansky, saying, "Don't try to save the entire world. Save one patient at a time." And that's a really important message that stayed with me for my entire career. It can be very daunting to think about having to take care of the whole world and even the whole community that you take care of. But when you think about it, all we can control is that one patient in front of us where we can make a difference, right? That honor and privilege and gift that we have. And never forget that gift. Never take it for granted. Never abuse it, and always cherish the gift that we have to be able to take care of patients and have that bond. So graduates, whether you're continuing your time at Jersey Shore or moving on to other facilities, or perhaps even other parts of the country, I know that you're all destined for great things and will ensure the health and well-being of your patients wherever life may lead you. Thank you for caring for our patients, for sharing your expertise with us, and for your commitment to our community. Wishing you success and luck in all that you do. Thank you from the bottom of my heart for the past X number of years that each of you has spent here. I hope your time has been worthwhile. I hope you feel we treated you well. I know Dr. Kuntz does an amazing job to make sure all of our residents and fellows are treated well. And I hope you'll pass the word on to future generations as well, that Jersey Shore University Medical Center and Hackensack Meridian Health are wonderful places to train in graduate medical education. Now it is my pleasure to introduce Hackensack Meridian Health's Co-Chief Academic Officer and Jersey Shore's Vice President of Academic Affairs, Dr. David Kuntz.
How about another round of applause for Dr. Sable? Well, thank you so much, and thank you all here at Hope Tower and the Jersey Shore campus, and welcome to all of you watching this wonderful ceremony on the live stream. I want to start by bringing greetings from our senior leadership team here at Jersey Shore. Mr. Vito Buccellato, Dr. Ellen Angelo, Dr. Kim Carpenter, and the entire team. You are truly our heroes. I wish all of you could hear the accolades that are often stated during our daily safety huddle. I think you are appreciated more than you realize. Sometimes it's something big and audacious, but often it's a nurse who makes a comment about something that a resident or a fellow did in the middle of the night that made such a difference for our patients. So we truly, truly appreciate the efforts that you all have put in during your training with us. I also want to acknowledge the commitment of our faculty and staff, especially over the last 16 months. It's really been heroic, your efforts to take care of patients and your commitment to training. May I ask all of the faculty, the chairs, the program directors, any other faculty to stand for a minute and be acknowledged. Thank you. Another group that I'd like to acknowledge are our program and fellowship coordinators. Now, the residents know that these individuals are absolutely the glue that hold our programs together. May I ask our coordinators to stand and be acknowledged. And finally, I want to acknowledge the hard work in putting this program together. Our GME institutional coordinator, Denise Spina. Give Denise a round of applause. Ms. Brianna Indelicato from Special Events, who many of you in this room heard a few minutes ago. Brianna, thank you for your support and efforts to put a beautiful program together for us. I wanted to make one comment as we are coming out of the COVID pandemic. We are going to need your continued efforts in the fight. You will all very likely be going to communities where there are still individuals who are hesitant, who are disbelievers, and you will have an even greater voice as you have advanced in your career to your primary residency, into your fellowship, into practice. We have communities where the vaccination rate is 25 or 30%, and hospital workers are also underrepresented, are largely in underrepresented groups, and also need support. You can be a very important voice to your next level of colleagues. So I encourage you to stay engaged, to see where you can make that difference one individual at a time. You know, I was reflecting a few weeks ago on an article that I saw. It was entitled, "COVID Has Made Friends Drift Apart." In the best of times, it takes work to maintain and grow friendships. And some friendships probably have grown stronger because of the pandemic. But I think we all realize that as a result of social isolation, Zoom, inability to travel, there's been a sense of loss for many of us. I would encourage you, in fact, challenge you to work on resurrecting your friendships. I'm going to take a couple of minutes to share a personal story of friendship that started with me during my residency. The follow-up to this story was just 3 weeks ago. And it's a quick story about mentoring, resilience, role reversal, and gratitude. Maybe I could show that picture for a minute. It is worthy of a chuckle, I agree. And I agree with you. How could he have ever really been that thin? This picture was taken in the fall of 1986. I was starting my second year as an internal medicine resident in a large program in Philadelphia. The individual with me in that picture is one of my senior residents. He looks much older, so you wouldn't believe he's only 2 or 3 years older. If you look at his picture and saw him in real life, he probably looked 10 years older, so everyone thought he was an attending. His name is Tim, and I actually had permission from him to share this story with you. He was a really great role model for me. He was a great clinician. He was organized. He was enthusiastic. He was optimistic. At this picture, he was our 4th year chief resident, a path that I followed a few years later. I stayed on at that hospital for a total of 9 years, largely under his tutelage. He helped guide my career in every way that you can imagine. In fact, it's fair to say that he believed in me before I believed in myself. As would happen and as is common, you can take the picture down for a minute. Okay. We'll show it again in a few minutes. We drifted apart, connecting less regularly. A few years later, I was practicing here in New Jersey, and hearing back from him, he'd actually moved around to several positions. He had left direct patient care and was in roles like medical director of our hospital or managed care. I thought it was a little funny that I would hear from him every couple of years asking if I could write another letter of recommendation or speak with another recruiter, but I thought that was because he was kind of on the fast track to becoming a physician executive. There was a time he called me with very little notice and asked if I could come to the hospital where he was working at the time to give a grand rounds lecture. This was for Tim, so of course I dropped everything and flew out to the city where he was practicing. After the lecture, I joined him for lunch, and as well as his wife, who was also a resident with us. And for the first time, I noticed something different. That optimism, that energy seemed to be gone. In fact, he and his wife were really snipping at each other, something I never remembered before. People go through ups and downs. Maybe he had some deadlines to meet, so I didn't think a lot of it. Fast forward a few more years, now out of the blue, Tim calls me. He had had a major personal health crisis. He had been diagnosed with ulcers with the complications of hemorrhage. He bled significantly to the point where he was hospitalized in an ICU. It took weeks for him to recover, and when he did, he was so debilitated, he needed to go to rehab. His job at the time tried to keep his position for him, but at a certain point, they had to move on, and he was unemployed. This was actually not the most difficult part of that conversation. He shared with me that he was an alcoholic. He said that he had alcoholism in his family, and for the previous 12 years after residency, he had relied on alcohol to get him through the tough times. Actually, I always remember that story when I hear Dr. Dumas and Dr. Freeman talk to us about wellness and self-care. Now his pattern of changing jobs was more understanding. He would move into a new position, and after a few months, the pressures would start to build. He relieved it through alcohol use. He would then be able to hang in there for a few more months until new deadlines would present themselves. And before he really started to perform poorly, he moved on to another position. On top of this, his marriage had dissolved, and he was really at a loss what to do. We both suggested it was time for him to consider returning to his roots of practicing primary care. He wanted to preserve his license. He was enrolled in his state's physician assistance program, and he joined Alcoholics Anonymous, and I'm happy to say that he has remained abstinent ever since. But getting that first job after what had happened was pretty difficult. I remember getting a call from the chair of medicine for a small hospital where he had applied to be a hospitalist. And I did my best to assure that physician that if he can hang in there, you had a stellar clinician on your hands. He had really lost confidence, and we had a role reversal. From those early years where he believed in me, I was reaching out regularly to him, encouraging him, discussing difficult cases, helping him manage the day-to-day of practicing medicine, something he hadn't done in a long time. Slowly, things began to turn around for Tim. He started in a relationship and actually remarried and had a daughter. And there were great signs of stability in his life. You can show the next picture as I wrap up. So literally 3 weeks ago, tomorrow, I got a call from Tim. I was in my kitchen with my wife, had my phone next to me. I looked at it, I showed it to her, and she said, "I'm sure you and Tim have a lot to catch up on. Let me know when the 4 of us, actually 5 of us with his daughter, can get together." But within a few seconds of the call, I realized that there was more bad news. Tim shared that he had been diagnosed with a progressive neurologic condition. He didn't state what it was, but just after a few weeks, he has been told he can no longer work and he can no longer drive. I was quiet on the phone, not knowing what to say. And he said, "You know, while I still feel pretty good, I wanted to call the 4 or 5 most important people in my life who are not in my family." He also said, "I don't want you to feel sorry. I feel grateful for the life that I've had, for the friends that I've had, for my daughter and for my wife." I asked him finally when I recomposed myself, I said, "What are your plans?" He said, "Well, I have a couple of goals. One is to see my daughter graduate from high school and hopefully from college. He's rather traditional. He said, my other goal is that I'd like to see her get married so I can walk her down the aisle. And if I can't walk her down the aisle, I hope to be able to go down the aisle in a wheelchair, and I hope that I'll know who she is. So let me finish with a quote. Growing apart doesn't change the fact that for a long time we grew side by side. Our roots will always be tangled. So for all of you, I wish you a tangled existence. I want you to focus on, for the next couple of weeks before you leave Jersey Shore, really establishing those roots with your colleagues. It can be the beginning of a very important and long-standing relationship, one that I am very grateful for. Thank you. It is now my pleasure to introduce our program directors, chairs, directors, who will then introduce their graduates. We're going to begin with our pharmacy residency program. Maria Almeida, Director of Pharmacy Services, and Michelle Cahoot, Program Director.
Thank you, Dr. Kuntz. I would like to first congratulate all of the graduates that are here today. I've had the opportunity to work with many of you throughout your time here at Jersey Shore. I wish you all of the best, and I do hope that our paths do cross again. So I now have the honor to begin with our pharmacy graduates. Our first graduate, Brandon Garcia. Brandon will be pursuing a PGY2 in infectious diseases at Cooper University Hospital and Philadelphia College of Pharmacy. Our next pharmacy graduate is Gianna Iantasca. Gianna will be pursuing a PGY2 in critical care at Atlantic Health System. Okay. Our third graduate is Elaine Liu. Elaine will be pursuing a PGY2 in infectious diseases at Hartford Hospital. And our final pharmacy graduate, John Hanayan. He is actually not able to be here today. He is on his honeymoon. However, he will be returning to finish the month out, and then he will be starting a fellowship in hematology oncology at Bayer Pharmaceuticals. Thank you.
Thank you. For those on the live stream, we will be acknowledging all of the graduates when we're completing reading the names. Our next program is Podiatric Medicine and Surgery, Dr. Joseph Sussman and Dr. James Sullivan. Oh, good.
Welcome, everybody. And I would like to take a minute just also to thank the family of both Mike and Kate who are watching by live stream. Unfortunately can't be here, but I'm sure are very proud, as they should be, of two great people that they've brought to our program. And I do appreciate that, and also to thank your spouses and significant others as well for all they've done by sticking by you throughout this time. And I would just like to welcome everybody here and wish you all the best of luck. Our first graduate is Michael Warren, and Michael is going to be staying with us within the HMH community, where he is going to be working in BRIC and at OMC as well. Our next graduate is Kate Florio. Kate also is going to be staying within HMH and will be working at Jersey Shore as well. So we're happy to have you remain with us. Thank you all.
Thank you, Dr. Sullivan. And next, I'd like to invite our dental department to join us. Dr. Chris Madsen, Chair, Dr. Fred Papworth, Program Director, Ms. Eileen Becker, our Coordinator.
Good afternoon, ladies and gentlemen. It is indeed a pleasure for me to introduce this year's graduating residents. This year's residents, in particular, were one of the best groups of residents we have had in terms of clinical skills and commitment to patient care. They will indeed be an asset to our profession, and we will be proud to recognize them as alumni of our hospital and our program. We'd like to thank our residents for their great job and commitment to our department, our patients, and our hospital. On behalf of the Department of Dentistry, I am happy and honored to congratulate and introduce this year's dental residents. Dr. Stephanie Lombardo. Stephanie is a graduate of Nova University School of Dental Medicine, and she's going into practice in Florida. Oh, I'm sorry. Our next resident is Dr. Michael DiPaolo, who graduated from Rutgers School of Dental Medicine. He'll be going into private practice in New Jersey. All right, great. Okay, Dr. Sarah Pekarski is a graduate of Touro School of Dental Medicine, and she's going to be practicing in New Jersey as well. Dr. Jenna Vanderwater, a graduate of Nova School of Dental Medicine, and she's going to be going into practice in Florida. Dr. Christopher Garofalo, graduate of Columbia School of Dental Medicine, and he'll be going into private practice in New Jersey. And congratulations to everybody.
Thank you. Our next program is Obstetrics and Gynecology. Dr. Scott Smilan, Chair, Dr. Noelle Aikman, Program Director, Ms. Vanessa Schroeder, Coordinator.
Good evening, everyone. So today's so bittersweet. It's very hard as a mom to send your kids out into the world, even though you know that they're ready and will prosper. Anyway, today I'm very happy and proud to say none of our graduates are going on to fellowship. With the US leading all the developing countries in maternal mortality and morbidity, and with New Jersey having the fourth worst mortality rate in the US, I'm happy that these 4 women will be women's health specialists, or generalists as we like to call them. They'll be working in the trenches. We need smart, empathetic, and courageous women like these 4 to fight for women and give them evidence-based medicine and unbiased care. I'd like to present our graduating residents, Dr. Jennifer Brown. She will be joining a private practice and working out of St. Peter's Hospital in New Brunswick, New Jersey. Our next resident is Dr. Shika Goel. She will also be in private practice, working out of Emerson Hospital in Concord, Massachusetts, or Boston. Dr. Camille Ricciardi will also be in private practice, working out of Lenox Hill Hospital in New York. And last but not least, Dr. Heidi Martinez Avila, who will be also in private practice, working out of Holy Name Hospital in Ridgefield Park, New Jersey.
Thank you, Dr. Aikman. I'd like to now introduce the leadership team of the Department of Pediatrics, Dr. Harpreet Paul, Chair, Dr. Alana Toreen, Program Director, Lori Catalgo, Coordinator.
Thank you, David. Good afternoon, everyone. I just want to congratulate all of the Jersey Shore graduates, but especially I'm extremely proud of my residents, my pediatric children. I have 2 of my own and I got 10 others. So first, I want to present Sneha Raju Daniel. She is going to be moving on to a pediatric endocrinology fellowship at the University of Pittsburgh Children's Hospital. Our next graduate is Thomas Patrick Fitzgerald, who will be doing a pediatric pulmonary fellowship at Children's National Hospital in Washington, D.C. Thank you. Next is Sarah Gagliotti, who is going to be staying with us here at Jersey Shore and being our clinical instructor, chief resident. Jennifer Kumji Lee is going to be doing a neonatal fellowship at Johns Hopkins All Children's in St. Petersburg, Florida. Woo, go NICU. Gregory Harrison Nalesnik will be doing a pediatric hemonc fellowship at Penn State Health Medical Center in Hershey, Pennsylvania. Michael Rao will also be staying with us as a clinical instructor, chief resident here at Jersey Shore. Amanda Michelle Romeu will be going to Boston University Medical Center and doing a pediatric neurology fellowship. Okay, this is a long one. Catalina Maria Alicia Scarfone will be practicing at Summit Health in Bedminster, New Jersey, doing general pediatrics. Jennifer Pauline Sevilla We'll also be doing general pediatrics in one of our practices with HMH in Manalapan, New Jersey. And last but not least is Brittany Ray Weissman, who was our fourth-year chief resident, who will be doing a pediatric development and behavioral fellowship at Boston University Medical Center. Thank you all, and good luck to everyone.
Thank you, Dr. Tureen. I'd like to introduce Dr. Jamie Pinto, Program Director of our Pediatric Hospitalist Fellowship. Dr. Pinto?
I'd like to congratulate all of the graduates. It's an honor and a privilege to announce my graduate, who happens to be on vacation, so she's not present. Dr. Sarita Wagley came to us from Virginia Commonwealth University with a passion for quality improvement and process improvement, which she really developed during her fellowship. She is going to use those skills to do some healthcare consulting at Mission Consulting and Services in Washington, D.C. She's going to maintain her clinical skills at the Baltimore Washington Hospital associated with the University of Maryland. I could not be prouder, and I wish she is here on Zoom to see her diploma. But we will accept her diploma on her behalf.
Thank you, Dr. Pinto. I'd like to introduce the leadership of the Department of Psychiatry to introduce their graduates. Ramon Sulca, Chair, Stacy Dumas, Program Director, Dana Benjamin, Coordinator.
Thank you, Dr. Kuntz, and congratulations to all of the graduates. We are extremely excited to be with you here today because this is our first ever graduation as a newer program. And so we are very excited to have our first two graduates. And these are the first two graduates who will be fast tracking into child psychiatry fellowship programs, which, as you know, Dr. Sulca and I are both child psychiatrists. And we've known both of these fabulous residents since before they were even in residency with us. So our first resident, which we will introduce, is Dr. Stacy Ann Wayne. She had joined us from St. George University, and she will be graduating and going on to a fellowship at Virginia Commonwealth University in child and adolescent psychiatry. So congratulations, Stacy. We will miss you. And our second resident that is graduating today is Sienna Ziemba. She was also part of our first class, and she came to us from Rowan School of Osteopathic Medicine with a passion for child psychiatry and community service. She will be going on to our own child and adolescent psychiatry fellowship here at Jersey Shore. So congratulations, Sienna. Thank you very much. We'll have many more graduates in the upcoming years. Thank you.
Thank you, Dr. Dumas. Now we have our Department of Internal Medicine, our largest program. Leading the presentations, Dr. Arif Asif, Chair, Dr. Christian Kausinger, Program Director, Dr. Richard Abramowitz, Associate Program Director, is joining us at the podium as well. Welcome, gentlemen.
Good afternoon, all. First, I wanted to congratulate you all on the successful completion of this part of your training. You know, for both my categoricals and my prelims, whether it's 3 years or 1 year, it's a big accomplishment. I wanted to thank you especially for your service during the pandemic. You really made a big difference in many, many people's lives, and I hope you realize that our community truly did depend on you. And lastly, good luck in your future endeavors. Let me know what you do. I always enjoy learning and finding out where you end up and where you go. All right, so I'm going to start off with Dr. Hannah Ibrahim Abamosa. She's going on to become a fellow in academic medicine at Pittsburgh Medical Center. Dr. Khushbu Kishan Kumar Agarwal. She's going on to become a hospitalist at our very own Riverview Medical Center. Dr. Arda Akaluk, who's going on to a nephrology fellowship at the University of Alabama. Dr. Marjan Alidust, she's going on to a rheumatology fellowship at the University of California, Davis Medical Center. Dr. Gabriella Angelina Conti, who's going on to be a Hem-Onc Oncology Fellowship here at Jersey Shore University Medical Center. Dr. Albina Kopka, who's going on to be a hospitalist. Congratulations. Dr. Shireen Dahab, who's going on into primary care, and she's staying local at Family First Primary Physicians. Dr. Gerard Fidelis Dadadine, he's going on to an ID fellowship at the University of South Florida in Tampa. Congrats. All right, next is Dr. Islam Salah El-Kapratawi, who is going on to be a hospitalist here at Jersey Shore. Next is Dr. Ishan Suresh Chandra Patel, who's going on to be a hospitalist with an emphasis on Hem-Onc at the University of Iowa Hospital. Dr. Syed Hassan Ramatullah, who's going on to be an academic hospitalist at Westchester Medical Center. Congratulations. Next is Dr. Marian Samir Ayad Sampson, and she's going on to be a hospitalist at St. Vincent's Hospital in Indianapolis. Next is Dr. Daniel Mark Shanuda, who's going on to become a nocturnist here at Jersey Shore. Congrats, Daniel. Congrats. And then Dr. Rubail Saeed Sumru, she's going on to a fellowship in endocrinology at Thomas Jefferson. And then next is Dr. Vandan Deepak Kumar Upadhyay, who's going on to a cardiology fellowship here at Jersey Shore. I just wanted to quickly acknowledge some of our chiefs. We had 5 chiefs this year. It was Dr. Hannah Abumasa, Dr. Gabriela Conti, Dr. Islam El-Kapratawi, Dr. Ishan Patel, and Dr. Syed Hassan Rahmatullah. Thank you very much for your service. So then next, I'd like to start off with my prelims, the young physicians that come and do a year here and go on to other things. I need to start, we have some here in absentia, so I will start with one, Dr. Ahmad Katnani, who's going on to an IM residency at Hackensack University Medical Center. Next, I'd like to welcome Dr. Joshua Ramos, who's going on to a family practice at Skokit Regional Health in Washington State. Next is Dr. Matthew Eli Rowland, who's going on to a PM&R residency at Thomas Jefferson. Congratulations. Dr. Pavan Prakash Shah, who's going on into diagnostic radiology at Thomas Jefferson as well. Dr. Avanti Suresh, who's going on to anesthesia at RWJ University Medical Center. I think there are a few now in abstention. Next is Dr. Nicole Tavernier, who's going on into anesthesia at UPenn. Dr. Danny Bao Huang Tran, who's going on into IM at Trident Medical Center in Charleston, South Carolina. Dr. Anton Voskresensky, who's going on into IM at Coney Island Hospital. Dr. Syed Wakas Ahmad, who's going on into diagnostic radiology at Cooper Medical Center. And then next, Dr. Mustafa Altai, who's going on into IM, internal medicine at Montefiore Medical Center in the Bronx. Congratulations. Okay, next is Dr. David Reuven Berezovsky, who's going on into interventional radiology at Rutgers RWJ. Congrats. Again, in absentia, Dr. Muhammad Daniel, who's going on into diagnostic radiology at Temple University, as well as Dr. Raymond Gonzalez, who's going on for a continued IM residency. Next is Dr. Yumna Hamid, who's going on into IM, internal medicine, at Wellspan York Hospital. Congratulations. Next is Dr. Heidi Hernandez. She's going on to family practice, family medicine in Siouxland Medical Center in Sioux City, Iowa. Dr. Omar Kamal, IM, to Ascension St. Agnes in Baltimore, as well as being in abstention today. Next is Dr. Linda Layham, going into anesthesia at Rutgers, New Jersey Medical School. Congratulations. Dr. Hassan Mirza, who's going on into IM at St. Mary Medical Center, Long Beach, California. Congratulations. Dr. Maurice Musseri, who's also going on into IM at Palisades Medical Center. And finally, Dr. Adam Munkin, who's going on into neurology at Northwell Lenox Hill. Congratulations. All right, thank you, everyone. That concludes our portion of the Department of Medicine, Internal Medicine Residency. We're moving on then to some of our fellowships.
Thank you, Dr. Kasner. Dr. Asif is going to stay up front as we announce our graduating fellows. For cardiology, is it Dr. Schoenfeld? Thank you for joining us, sir. Please introduce this year's graduates.
Good afternoon. My pleasure to present the graduating cardiology fellows this year. Had the pleasure of working with these two for the past 2 years. Two very aspirational characters, all for good things, I guarantee it. First, we have Arif Abaji. Arif is going on to an interventional fellowship down in University of Florida. Next, Matt Maleka. Couldn't stay too far away from him. Also going to Florida for an interventional cardiology fellowship at USF Largo. I got it. All right. Thank you.
Thank you, Dr. Schoenfeld. Now I'd like to introduce Dr. Eric Costanzo to introduce our graduates from our Critical Care Fellowship.
It's a pleasure and an honor to be up here celebrating these 4 fellows that have been with me. I'd like to take a moment to thank the academic and administrative leaders in this institution for really supporting us through a very difficult and challenging time, especially for the critical care fellows and a few cardiology fellows on loan that helped us through Surge 1. And a special thanks to all the residents who have become like family to me. It's always sad to see you matriculate and move on, but I know you all stay in touch, and I look forward to following your careers. It is with great pride and some sadness that I introduce my team that has been with me pretty much for 6 or 7 years in total, who are now moving on to bigger and better things, well-trained and ready for their next walk in life. So I'd like to first introduce Mustafa Fidel, who will be moving on to Robert Wood Johnson Hamilton as an intensivist. Robert Wood Johnson Hamilton is lucky to have this young man. It's also my honor and privilege to congratulate Usman Mazahir, who will be moving on to Independent Lung Associates in Florida. Florida will be lucky to have this young and talented physician. Gadir James Al-Saudi will be staying with the little-known practice of Shore Pulmonary. I'm not sure what we were thinking, but it is very happy and an honor and privilege to bring him on board with us. This young man has become an adopted son of mine, and I've loved watching his career arc grow. And in absentia, but online, is Haney Malfus, who will be practicing critical care and nephrology out west. It's an honor to celebrate his matriculation.
Well done. Oh, boy. By the way, I didn't introduce our fellowship coordinator, Jackie Monero. Thank you for joining us up front. Our endocrinology fellowship, Dr. Rachel Ong, Associate Program Director, will introduce this year's graduate.
It is truly my honor and my privilege to present to you our very first graduating endocrine metabolism and diabetes fellow here at Jersey Shore, Dr. Monica Okula, who will be going on to private practice in California.
And now our nephrology fellowship, Dr. Avanis Masood, Program Director, will introduce this year's graduate.
Yeah, with a great pleasure, I introduce Jennifer Robin Connelly, my fellow, and she's not going anywhere. She's staying here for a critical care fellowship. Jennifer has been a great fellow, and hope she will carry on the good work she did and she learned during her nephrology fellowship. Thank you, Dr. Connelly.
So before I introduce Dr. Campbell, if we were with all of your family and friends, we would be whooping it up. So this is now your chance to whoop it up so that everyone on that live stream really gets a sense of what you think about your graduation and your colleagues' success. So let's whoop it up for a minute. Well done, everyone. I'd like to now introduce Dr. Natasha Campbell from the Department of Medicine to introduce for the department the Intern of the Year, Resident of the Year, and Fellow of the Year. Dr. Campbell, welcome.
All right, good evening, everybody. Thank you so much for all being here. And you know, it's sad that families can't be present, but I know that everybody's here in spirit, and I'm glad that we could have a live stream. So it's my honor to announce these awards. The first award is the Intern of the Year award. This particular doctor has amazing colleagues as well, and it was a very difficult, you know, decision. But this specific doctor really showed so much dedication to his patients, families, and we'd really like to recognize Dr. David Berezovsky as the Intern of the Year. All right, and our PGY2 Resident of the Year, who can't be here today, but we'd also like to recognize him for his excellent teaching, is Dr. Asil Albayati. And our PGY3 Resident Teacher of the Year goes to the one and only Dr. Islam El-Kirbatawi. All right, and last but definitely not least, I'm going to copy what Dr. Schoenfeld said about the interesting character. Our Fellow of the Year goes to Dr. Matthew Malika. All right, and that concludes the awards. Thank you.
Thank you, Dr. Campbell. We're now at a very historic, long-standing tradition for a ceremony such as this, and that's the recitation of the Hippocratic Oath. It's a wonderful opportunity for us to reflect on something that many of us recited years ago as we go out to our advanced residencies, fellowships, and practice. I'd like to invite Dr. Stacy Dumas to lead the graduates in the recitation of the oath.
Thank you very much for the honor, Dr. Kuntz. I'm going to take off my mask. I do solemnly swear by that which I hold most sacred, that I will be loyal to the profession of medicine and just and generous to its members, that I will leave my life and practice my art in uprightness and honor, that into whatsoever house I shall enter, it shall be for the good of the sick, to the utmost of my power, holding myself aloof from wrong, from corruption, and from the tempting of others to vice, that I will exercise my art solely for the care of my patients, and will give no drug and perform no operation for criminal purpose, far less suggest it, that whatsoever I shall see or hear of the lives of my patients, which is not fitting to be spoken, I will keep inviolably secret. These things I do promise, and in proportion as I am faithful to this oath, may happiness and good repute be ever mine, and may the opposite befall me if I am false to my word. Thank you.
Thank you, Dr. Dumas. Important words for us to remember on this day. We're going to conclude our program with remarks from Reverend Cynthia Wilcox. Reverend Wilcox is our manager of pastoral care. She is also our resident ombudsman, a very important role to be another resource for our residents during tough times. Reverend Wilcox, thank you for joining us this afternoon.
As many of you know, I took over for Reverend David Cotton, and when he was retiring after 27 years, he said the favorite part of his job was working with the residents and the fellows, and I had no idea what he was talking about, because I've never been to one of these. And now I understand how powerful this moment is, so thank you for inviting me here. It is an honor to be with you, celebrating this moment. Did you get a chance yet to sit back and breathe and savor the fruits of your labor? Let's reflect where it all started a long time ago, probably more than 8 years ago, when you chose to show up and burn bright and live passionately with a vision to invest your life and your strength and your mind to make a difference in people's lives. Take a minute to remember what that experience was that triggered you to make this huge commitment. Because of my background in fitness, all the metaphors will be physical. I propose it all started because you decided to sign up for this marathon road and trail race, and then you committed to showing up on day one with a vision and intention to see it through, perhaps with a combination of supportive family, friends, classmates, professionals, or your own grit. But you kept showing up, day after day, week after week, month after month, year after year. Are you feeling it? Yeah. You each tied up your own pair of healthcare training sneakers. In all the diverse places of origin, you set out on this long, circuitous course, and I'm sure that there were many twists and turns that you had not anticipated, and some parts of the course that seemed unmarked and quite treacherous, like Heartbreak Hill on the marathon for Boston. But that initial experience that triggered your commitment to healthcare, remember what it is? That kept you going. And today, you are at a residency and fellowship graduation. And it's not the finish line, but it is a major milestone, a refreshing water station. Drink it in. While you were showing up, you were also burning bright. You fueled and refueled your mind and your body and your spirit. I watched you absorb new information, withstanding those long residency hours, and to connect on meaningful levels with fellow students and patients and families, all simultaneously. As a chaplain in the hospital, I got to see many of you in action, and it was admirable sight to behold. Thank you. While you were showing up and burning bright, you also chose to run this race passionately. You allowed yourself to be vulnerable, taking risks, journeying way outside your comfort zone, and we here at Jersey Shore are grateful and we applaud you for that. You have been running full on at a good clip toward the goal to which you have been called: to serve humans in need, to offer health and care. And now you've been trained to be the instruments of healing, and that is so powerful. You've showed up, you've burned bright, you lived passionately, and I propose there's times, especially this year, when you've had to put your palms up and leave the rest up to divinity. The head of all bioethics for Hackensack Meridian System said, sometimes there are situations that we are called to just muddle through with grace. And we did. I call it palms up seasons. We got through it because we didn't lose the vision of why we do what we do. At this juncture, there will be dramatic changes in terrain. There's a big turn in course. And after you catch your breath from the uphill grade and you grab some Gatorade, remember, you have already shown the world and yourself that you know how to show up. You know how to, I bet you know it by now, burn bright, live passionately. But I propose, as Paul Harvey would say, there is the rest of the story. By constantly running at full speed, constantly striving to burn bright, live passionately, all that, we might lose sight of what that original vision was. I encourage you to take some time to practice the fine art of remembering the vision, resting, renewing, releasing, whatever is out of your control. Or you might become a tightly wound human contraction, unable to hear or see or interact with humans that are transforming. 25 years ago, when I was a personal training fitness person teaching 16 group exercise classes a week, a spiritual director came up to me and said, "You work with muscles, right?" "Yeah." "Am I right in saying that a beautifully developed muscle contracts and with the same range of motion it releases?" I was like, "Yeah, what's your point?" "And as you're releasing, that's where the muscle fibers tear, and across those tears is where the muscle grows?" "Mm-hmm, yeah, mm-hmm." And she said, "Well, I propose lives are the same. To have a beautifully developed life, we have to contract, and with the same range of motion, we have to learn how to release, to let go of some things and let the growth happen." And then she turned and walked away. Just 25 years later, I'm still finding more insights around this reality. If we don't remember our call, reflect on our commitment that we made, rest and release, And remember, what's not ours to carry, our capacity for exponential growth will be compromised. I pray that you continue to run the good race that's been set out for you, that you show up, what? Burn bright, live passionately, and that you design a beautifully balanced, soul-satisfying life with a mix of remembering and vision, running and releasing, all for the good of humanity. Please receive the benediction. Brothers and sisters, whatever is true and noble and right and pure and lovely and excellent and admirable and praiseworthy, think about these things. If you've seen anything or heard anything or learned anything, go and put it into practice. And may peace, salam, shalom be with you. Amen.
I can't think of a better way to end this ceremony. Thank you so much, Reverend Cindy, for those inspirational words. This concludes our graduation. For those on the live stream, thank you for joining us. For graduates, thank you again for all that you've done. Remember, on your way out, there's a gift for you, but you're welcome to stay in as individuals or in your groups to take some photos here at the front of the auditorium. We are now adjourned.